Hello everyone. Welcome to our YouTube channel Shree Swaminarayan Physiotherapy College, Rani, Ahmedabad. I am Dr. Suman Malukani. Today we are going to talk about the structure of thoracic vertebra. The vertebral column is composed of 33 vertebra and 23 intervertebral discs divided into 5 regions: cervical, thoracic, lumbar, sacral and coccygeal. Thoracic region constitutes 12 thoracic vertebra. The first and the 12th thoracic vertebra are called as transitional vertebrae as they possess the characteristics of cervical and lumbar vertebra respectively. The majority of the thoracic vertebra have basic structural design except for some minor variations. Let us now see the structure of a typical thoracic vertebra.
A typical thoracic vertebra is divided into two major parts: anterior vertebral body and posterior neural or vertebral arch. The vertebral body of a typical thoracic vertebra has equal AP and transverse diameter. Thoracic vertebral bodies are wedge shaped with posterior height greater than the anterior height to produce normal kyphotic curvature of thoracic spine. On the posterolateral region of the vertebral bodies, we have half facets or demifacets for articulation with the head of the ribs to form costovertebral joint. The posterior neural or vertebral arch is divided into pedicles and rest of the posterior elements. Pedicle forms the connecting link between the anterior vertebral body and the posterior element. The pedicles in the thoracic region are oriented posteriorly with little or no lateral projection for transmission of the forces from posterior elements to the vertebral body, which is the main weight-bearing structure of the spinal column. The posterior element consists of superior and inferior articular processes, transverse process, spinous process, and lamina. The articular processes are also called as zygapophyseal articular processes or facets. The superior articular process articulates with adjacent cranial vertebra and the inferior articular processes articulates with the adjacent caudal vertebra. The superior facets are directed posteriorly, laterally, and superiorly, while the inferior facets are directed anteriorly, inferiorly, and medially. The orientation of the facets in the upper thoracic region is predominantly in the frontal plane, so lateral flexion and rotation are free in the upper thoracic region. Flexion and extension movements are limited in the upper thoracic region due to the rigidity of the rib cage and the orientation of the facets. As we approach towards the lower thoracic region, there is change in orientation of the facets. They lie more close towards the sagittal plane, so flexion and extension movements are more available in the lower thoracic region as compared to the upper thoracic region. The transverse processes in the thoracic region have thick ends with large oval facets, also called as costotubercle facets, for articulation with the tubercle of the rib to form costotransverse joint. The lamina are centrally placed and serve as a point of origin for rest of the posterior elements. The laminae in the thoracic region are short, thick and broad and transmit the forces from the posterior elements to the pedicle, from which it is transmitted to the anterior vertebral body, which is the main weight-bearing structure of the spinal column. We will discuss the difference in the orientation of the spinous process in the upper thoracic region and the lower thoracic region. The spinous process of the upper thoracic region from T5 to T8 is projected inferiorly. The spinous process of the lower thoracic region is more triangular and horizontal. We'll see the comparison. Inferior projection, more horizontal projection. The vertebral foramina in the thoracic region is small and circular because of the equal AP and transverse diameter.
Thank you everyone. Do like, share and subscribe to our channel.